Key issues are things like the staff screening. Obviously all teachers and staff within different departments will be screened prior opening of school. Frequency will be dependent very much on whether staff are vaccinated or unvaccinated. Say the majority of teaching staff, as example, are 90+% vaccinated, so the frequency for those is every 4 weeks. We've tried to make things as simple for staff and as safe as possible for students. As I say, that there are key recurring themes that we look at. As an example, mask wearing. Even though masks are not necessarily advocated in schools generally, there are circumstances, particularly within the building, where unvaccinated staff and students above the age of 16 will be advised to wear a mask. Those members of staff who are vaccinated obviously don't, and we're also looking at visitors, members of the public visit, but also external agencies that come into schools to provide additional tuition and so on. There's also protocols to cover their attendance, their entry into school environments.
You mentioned what will happen for staff that have had the vaccine, testing every 4 weeks. Could you just clarify what would be the case for staff who haven't had the vaccine?
Unvaccinated staff, and this is not only teachers but staff throughout the department, obviously there's a requirement to test every 2 weeks.
You mentioned that students and staff who haven't had the vaccine will be advised to wear masks in certain situations. I think you mentioned corridors. So is that just advisory, or is that a restriction that they have to abide by?
It's very much a department policy, so yes, it's something that's going to be enforced. I say it is backed up by the most recent public health advice. Having said that, obviously the advice is continually reviewed. We're in constant communication with Director of Public Health and other colleagues with regards to what the best and proportionate measures are. So it is something that is very much looked at on a daily, weekly basis.
Well, we've had the outgoing Director of Public Health, Dr. Barton, refer to the start of schools as the start of new transmission bridges as children spend more time together and different households have more contact. So how are we going to handle issues of isolating?
The first point is obviously the screening. The screening will help identify any sort of recurrence, and more importantly, any new variants that may come up, which I didn't mention earlier, but the variants are what we're really looking out for. It's a new variant, obviously, it's something which we need to plan and address accordingly. We're not quite sure how that variant could act within the community. So I say every positive case is genome sequenced for variants, so that will give us an indication if there's any changes.
Finally, is there still a possibility, should things really escalate, closing schools are still on the cards?
Yeah, obviously I think the paramount issue here is to keep children in school and keep children in school safely. So everything we're doing is in lines of keeping that. Obviously the intelligence will dictate, and public health guidance will dictate if we get to that measure. We're hopeful that it won't get to that. And a lot of the mitigating factors we're putting in, an example being hopefully vaccinating 12 to 15-year-olds. This will have another additional tier of protection within the community. So all these are risk factors which are working in our favour. So it's something we would plan for, but it's not something we're hoping we'll have to look at.